It was Albert in 1879 who first described the procedure of ankle fusion for the treatment of ankle arthritis. This became the mainstay treatment for the treatment of painful ankle arthritis. What is arthritis? Arthro means joint, itis means inflammation. So this is a group of diseases which damages the joints of the body. We know that cartilage in the ankle is quite unique. It's able to withstand the stress better than cartilage of the hip or of the knee. And as such, we do not see ankle arthritis in the numbers that we see with other large joints, such as the hip or the knee. What really helps joints move is the synovial fluid in the joint. This is an image of synovial fluid. It has a consistency of egg white, and normally you could see through it. This helps joints move pretty much friction-free. What is a fusion? These are 3 x-rays of different types of fusions. You could see that screws and plates are bolting the talus to the tibia so that the joint doesn't move. Fusion is a procedure in which the joint is eliminated and the bones are joined so that they do not move at all. The procedure is called an arthrodesis, and the goal is to get them to join or to fuse together. This is done with a purpose to relieve the pain of arthritis. When we undergo a fusion procedure such as this, you could see that the shin bone, the tibia, is bolted directly to the talus bone so that there's absolutely no motion between the two. With long-term clinical results of ankle fusion surgery, we see good to excellent results in 90% of people. Radiographically, if you look at the literature, fusion occurs in 60 to 100% of people. It used to be considered the gold standard for the surgical treatment of ankle joint arthritis. How do people walk with a fusion? This is an example of someone who came into clinic who has a fusion on one side, and they don't hurt and they're not limping. This is their x-ray, and you could see that the fused ankle joint side is on the left compared with the right side, which is not fused. Now this is a slide of total ankle joint surgery compared with ankle fusion surgery. And in this study by Nelson Suhu and colleagues, they looked at ankle fusions compared with ankle joint replacement. The revision rate of ankle joint fusion was half of that compared with ankle joint replacement. One thing to be aware of is with an ankle joint fusion, there can be accelerated degeneration of the other joints in the foot. What people notice with ankle joint arthritis is a deep pain in the lower shin region, in this gray region on this foot model. The pain may come and go. It can vary in intensity, and it may be a constant low-level pain. Often with activity, the pain is worse. If you notice popping or clicking, this may be a sign that the cartilage is starting to wear away. A lot of people notice stiffness in the morning, and at the end of the day, the swelling can become significant. And with bad arthritis, we often notice a change in gait and difficulty with ambulation. We make the diagnosis of ankle arthritis on physical exam with pain in palpating the ankle joint itself. And then an x-ray is often obtained which can demonstrate narrowing of the ankle joint itself like this x-ray shows. We always start conservatively, and the treatment consists of an anti-inflammatory medication. Sometimes we'll offer a brace such as this ankle foot orthosis brace. And then we will often inject joints with a steroid directly into the joint itself. We do know that physical therapy can help, and we know that exercise enhances neuromuscular performance. And there's been found to be no detrimental effect on the arthritis itself with physical therapy. Some people may need to modify their activity using some type of a mechanical unloading device like a cane or a walker. And then lastly, sometimes resort to pain medication. The indications for operative treatment includes a painful ankle joint, which is arthritic, and those who have failed conservative treatment. There are also contraindications for going to surgery, and this includes poor blood flow to the leg, an active infection, inadequate soft tissues, people who smoke, or people with multiple medical problems which preclude safe surgery. The surgical procedure of an ankle fusion is performed either under general anesthesia and/or a nerve block. The joint is then removed and then compressed in the proper position with a series of jigs that we use to line up the foot properly. And then the tibia and the talus are secured with a metal plate and/or multiple screws. We start with a period of non-wapering protected in a cast, which is necessary to allow for the joint to fuse with time. This procedure is usually performed in an inpatient setting, and our people will spend one or several nights in the hospital. The cast is applied and kept in place for up to 3 months. Sutures are removed at week 3 as long as the incision has healed, and the cast is reapplied until week 6. We usually obtain an x-ray at week 6, and if the x-rays look very good, we'll occasionally place our patients in a cam boot and allow them to ambulate up until week 12. If the x-rays don't look good, then we place our patients back in a cast and keep them non-wapering. What you need to expect if you undergo this type of procedure is that you need to be non-wapering until there is evidence of fusion on x-rays. Now remember, you could still have motion after an ankle fusion. This is a video of someone moving their foot after ankle fusion, and the reason that there's motion is because that the joints in the foot are still mobile. In conclusion, ankle fusion is a good procedure with good outcomes for the treatment of painful ankle joint arthritis. The goal is to improve pain and to improve ambulation. Here is somebody walking with an ankle fusion, and they say that they don't hurt like they did before their surgery. What you need to look for is a surgical team that has experience. You want a surgeon who has further training beyond a general orthopedic surgeon training, and someone who's fellowship trained in foot and ankle surgery. You also should pick a surgical team that is methodical and not overly aggressive. Patient selection matters, and what you need to do is pick a team that you trust and a team that will listen to you and take care of you. Thank you for your attention. Should you have any further questions, please contact our office at the Coughlin Clinic at the St. Alphonsus Regional Medical Center.